the stars of night. I will make their darkness bright.
Who will bear my light to them? Whom shall I send?
Here I am. Here I am. Is it I, Lord? I have heard you calling in the night. I will go. If you lead me, I will hold your people in my heart. By the Lord of snow and rain, I have borne my people's pain. I have wept for love of them. They turn away.
I will break their hearts of stone, give them hearts for love alone. I will speak my word to them. Whom shall I send?
Here I am. Is it I, Lord? I have heard you calling in the night. I will go.
Hi, good morning, everyone, and welcome to another episode of Catholics at Home podcast. Good morning to each and every one of you, wherever you are tuning in from. Welcome to our Catholics at Home podcast, and we are great that we are able to. We are grateful that we are able to connect with you this morning once again. And so we are starting much earlier than usual. We usually start at 10:30, but today we have a different format, a little forum, a little conversation, a bit more extended that we are doing here. And that's why we are starting at 10 in the morning. But before we begin, just to say hi to the people who have tuned in. Just let me just call out a few names. We have Kumang Lubuk. Uh, Hi, good morning to you. We have Marika Lunting, Cecilia O. We have what. Hi, good morning. We're not too sure where you're logging in from, but do let us know where you are logging in from. Bill Larus, for the Bill. Good morning to you. Good morning, Anne. Good morning, Marianne, and to the many others. Hi, Diana. Good morning to you. And to all our other viewers who are tuning in, do drop us a little good morning or a heart or a love in the comment section before we begin our conversation. And so we like to, it's an interesting topic that we're having this morning, and we'd like to invite you to share this conversation. If you are following us on Facebook, do share or watch live with your friends. If you are on YouTube also, do share that link with your friends and invite them to this interesting conversation on the sanctity of human life that we're going to talk about. Life at its very beginning, from a perspective both church and also what's happening around us. It's an interesting conversation that many people are talking about. So this morning, hopefully, we will shed some light also regarding the church's position with regard to life at its very beginning. And because we are having a long show, I'm straight going to jump into this conversation and invite the host this morning. And I would like to invite Charlene to come into our studio. Hi, good morning, Charlene.
Good morning, Father. Thank you so much for having us.
Yeah, so we are doing something different this week. Something we have not done before. We are collaborating with the Archdiocese of Human Development and a few other partners this morning. And Charlene is going to be our moderator for. She's literally going to crack the whip if we don't stay in line. I guess. So Charlene, over to you, Charlene. Let's have a interesting and experience and a conversation this morning.
Brilliant. Thank you so much, Father Clarence. A very good morning, everyone. Thank you so much for giving us your time and for being with us today. Now, as Father Clarence has said, and I echo his sentiments, it's a very delicate issue we're talking about, and we're looking at it from a Christian or Catholic perspective. And so we've got an esteemed panel of speakers today, and I'm just going to briefly introduce them to you. There are four of them. Now, the first speaker is Dr. Alex Matthews. He is a consultant obstetrician and gynecologist. Now, I've had the pleasure of actually instructing Dr. Alex as one of my experts in my medical legal matters. And I understand entirely why he's not only well respected, but also very much highly revered by his peers within the medical profession as well as those outside. He's been in government service for 30 years and he's currently in private practice. Thank you for being with us today, Dr. Alex Matthews. Now,
Thank you.
thank you, Dato. Now, our second speaker is Mr. Christopher Fu. He is an advocate and solicitor. He's been in active practice, legal practice, for over 40 years. And again, I've also had the pleasure of working in the same firm as Mr. Fu for the past 10 years before his retirement. Now, as you would know, with lawyers, they're usually either those in practice that are they're usually either litigators, those who go to court, or those who are known as corporate lawyers. Now, Mr. Fu actually has the distinction of being excellent in both. So he's both a litigator as well as a corporate lawyer. And I know firsthand that he is an effective advocate and a brilliant strategist. Thank you again for being with us, Mr. Fu. Our third speaker today is Dr. Juliet Matthew. She is a medical officer and a registered counselor. She's a full-time lecturer at the School of Medicine at IMU, the International Medical University, and she also runs her own psychology center known as JMJ Consultancy. Dr. Juliet is the immediate past president of the Catholic Doctors Association of Malaysia and the vice chairman of the Selangor branch of the Malaysian Medical Association, the MMA. Thank you so much for being with us, Dr. Juliet. Lovely to have you. And last but definitely not least, I know he needs no further introduction, but I will still introduce him nonetheless, Father Clarence. A priest and moral theologian, of course, we know he's a man who wears many hats, all with equal passion and dedication. The current Chancellor, Archdiocese of KL, effective 2002. Interestingly, lectures at various universities, including the University of Cambridge in UK. So there we go. We've got an amazing, diverse panel today. And without further ado, perhaps I'll start with Dr. Alex Matthews first. Good morning,
Sure.
Dato, and thank you for being with us today.
Hi.
Now, I think it's important to perhaps lay down the medical perspective, right? Because when we talk about conception, I think it's very heavily related to the medical realm. So, as you see today, we focus on the issue of conception. And perhaps you can start by explaining to us what are some of the challenges to fertility, Doctor?
Okay. Thank you, Shalin. It's a privilege to come and address you. Pregnancy and infertility is a very sensitive issue because pregnancy is one of the most delightful, yet one of the most devastating moments in life is when you can't get a pregnancy or the pregnancy that fails somewhere along the way. I'll go straight to the issues. One of the most important issues we need to look at is age. As you know, well, you may or may not know that when a person is born, there is a fixed number of eggs in an ovary, in both the ovaries put together. You never have more eggs than when you were born. You get about 1 or 2 million eggs actually in the ovaries at that time. And every year, several of those eggs die off. So by the time a woman reaches the age of puberty, she only has about 300,000 eggs left. So that's all that you can do. It's unlike a man who produces sperm continuously throughout the reproductive life. So the age at which you start trying to get a baby is very relevant. And what's happening in this current generation, people are marrying later. People are very often mothers are working mothers and they don't have the time to have the opportunity to get babies. And many of the people who are professionals have to leave the station, go to different places. So the opportunities that were existent before is not as convenient as it used to be. Now it's very different. Now, many women marry late. As you know, some women marry at the age of 35, some even 40, some out of choice, some because of circumstances. But just to let you know, at 25, your fertility is the highest. Between 20 to 25, one's fertility is highest. By the time you reach 30, listen to this, your fertility rate drops to 50%. And by the time you reach 35, it is significantly lower, and 40 very much lower. So in terms of when you start to seek treatment, really depends on your age. If you are 35 or 40, I would say straight away go and see someone who can counsel you and advise you as to what to do. If you are 25, 1 to 2 years is fine. So in terms of giving a fixed number of months or years, it's very difficult. It depends on a person's circumstances. But age is one of the most important criteria in terms of understanding fertility in the present age. In fact, we realize now, if you look at statistics all over the world, the fertility rates have dropped significantly over the last 50 years. And the things that I talked about are important, but other things have taken place as well. The environment, smoking, alcohol reduces the chance of getting pregnant. Then, as you get older, the chance of you getting some of the common gynecological diseases which affect pregnancy become more frequent. For example, endometriosis, many of you would have heard of this condition, fibroids, and you have comorbidities like diabetes, hypertension, obesity. They significantly affect the chances of one getting pregnant. And with these stress factors and comorbidities, the quality of the sperm in the male also drops. So many things work together. Now, in addition to that, we've got other things that come about. One has to, if you want me to speed up, I'll do that.
No worries, Doctor.
No, okay, I had a bell. Okay, miscarriages. If you have had a miscarriage, if you have had 2 miscarriages, you certainly should be starting on investigations for infertility or causes that could have caused the miscarriage. So there is no fixed time or age for this.
Okay.
Then in terms of males, erectile dysfunction is becoming a bigger and bigger problem. Premature ejaculation, which makes it difficult for people to get pregnant, is becoming common. Congenital variations in anatomy in a woman can affect this, and these people should quickly see a doctor long before they try for a baby or even before they get married. And another problem that is facing us worldwide as an epidemic is infections, STDs. For some STDs more than others, chlamydia and things like that. So if you have that, go for checkups, go for fertility tests early. Now, that's in terms of why we worry about the age and the related factors. Many people ask, what? Yeah, sorry. Go ahead.
Sorry, Doctor. So you've identified the factors, and I was just wondering, with regard to perhaps some of the conditions you've mentioned. So, for example, in women, you've got endometriosis, fibroids, and then for the men, you've got erectile dysfunction, premature ejaculation, and also one that's common in both sexes, which would be STDs. What are some of the treatment that are available? Are these situations which are reversible? And if yes, what are there corrective procedures that are available medically?
Yes, all these conditions have interventions that can help. Certainly, the fertility rate is lower than a person who doesn't have this, but much can be done. So the answer is yes. I think it's necessary to go for treatment. Many people go for treatment for endometriosis simply because of pain, but the associated problem that comes with it is infertility, and that's probably a bigger problem than all the others.
Thank you. Now, with technology advancing at such a fast rate, Dr. Alex, what are the assisted reproductive technology, or ART, art methods which are available in Malaysia currently?
Okay. Actually, we have everything that is available anywhere in the world today. It's a question of access, it's a question of cost, and these are the main things. And also it's a question of when you start. I think more important is the idea, the concept of when you start looking for alternative methods. One must try everything possible using the simple methods, because there are other causes of infertility. You've got difficulty in ovulation. There are tests that you can do for ovulation long before you start going to see a doctor. Whether you do a blood test or a urine test, or those days we used to use temperature tests, but there are many things that can be done. In terms of tubes being blocked, for those also there are tests that can be done. And if you have had STD, for example, that's worthwhile doing quite early. And in terms of testing the semen, that's another test that can be easily done, but not to be done for everybody who gets married. I would say it is something that you want to do after you've tried for a little while. Okay, sorry, your question, I haven't addressed your question about the fertility sort of special tests that we can do. The one thing that's commonly done is something called IUI, intrauterine insemination. That is not considered an assisted reproductive technology. It's something that's done where the sperm is taken, processed, and put inside a woman's womb. But that doesn't involve sexual intercourse. I know this is a Catholic forum, and I'm not going to go into the religious aspects and the guidelines from the Catholic Church because I'm no expert in that. But the whole area of assisted reproductive technology is something that has been dissected and discussed and analyzed by the Catholic Church. In fact, all the churches, and different churches have different positions on this. So all the assisted reproductive technologies are methods that don't involve the man and the woman being together sexually. It is a conception that occurs outside the womb. So that's the first thing that we must recognize. And if the church says this is not something that they would recommend, I would say that's not something you want to pursue. But for information, even if you don't go through that, it's useful to know what happens. The commonest thing is what we call in vitro fertilization, where the sperm is taken separately and the egg is teased out of the ovary at the time that the egg is coming out, and they are put in an artificial environment and they're put together, and some of them become zygotes. It means become early pregnancies, and a slightly later stage, it's put into the uterus.
Sorry, Doctor, we seem to have lost you.
Sorry, there's
Can you
something
hear us,
wrong on
Doctor?
my screen.
Okay, no, we can hear you
That's
now.
essentially what it is. Okay, are we still in communication?
Yes, we can hear you now.
Can you hear me?
Yes.
Yes. Okay. Then there are variations of IVF, something called ICSI, where there's very few sperm, where the doctor can choose one single sperm and inject into an egg. That's a variation, but a very useful one for people whose sperm counts are very low. Then you've got variations of this where you don't impregnate the woman immediately after getting the eggs to form. These can be frozen and kept for a long period of time and put back into the uterus at the time that the doctor or the person who is trying to get pregnant wants it to be tried. Now you can put back 1 or 2 or 3 or 4. And we've heard stories of people getting 6 and 7 babies at one time. The current practice is not more than 2. Often they only put 1, because one of the side effects which is not very good is with IVF, you get multiple pregnancies, twins, triplets, quadruplets, and the babies who are quadruplets and triplets actually do less well than the singleton babies. So that's an important problem. And the other thing that has been done now is PGD. I think this is something that we need to know. This clearly the Catholic Church does not approve, and many churches don't as well, where you make diagnosis of conditions of the of the embryo by teasing out the cells and analyzing them, and you find that they've got certain diseases, and we say, okay, this pregnancy should not start, so they will discard that embryo. Or the same thing is used for sex selection. You can say, okay, this is a girl baby or a boy baby, and the mother says, I don't want. And in many places, they comply with the wish of the mother in this situation. Yes, these are the options that are available. And I think we need to recognize it's a very thorny issue in terms of what we do. Okay, other risks. These are the main modalities. I don't think we need to go to any of the other options which are very infrequent.
Brilliant overview, Dato. I just want to pick up on something you said earlier on, and for those of us who are watching, and especially the young couples who are starting.
Sorry, let me try and get your volume higher. I don't seem to be picking up so well.
No worries. Can you hear me now,
Okay.
doctor? Yeah?
I don't know what's going wrong. It's very, very
We
soft.
can.
Are you
Oh,
hearing
okay.
me all right?
Yes, we hear you well. We hear you
Okay,
well.
I'll just lean forward a little.
Okay, I'll try and speak louder. So I was saying, for those young couples out there or those who are looking to expand their families, something you said earlier on, Dato, is that you should get tested after having tried for a little while. So the question on our minds is, how long is a little while? How long should I be trying for a family before realizing, I think I need to look at things a little
Okay,
deeper?
it's thank you. I think it's a very, very important question. But if you go back to the first point I brought up about age,
Mm-hmm.
the older you are, the sooner you go. That's a simple
Right,
rule. If
right.
you're 40, you go as soon as you get married. If you're 35, talk with your GP, talk to your friend who is a doctor. But if you're 25, I would say minimum of 1 year of
Okay.
regular opportunities for conception. As I
Mm-hmm.
said, many people meet maybe once a month because they're outstation a lot of the time. Then to say that they have been trying for 1 year is not true. And this is very common. They don't give themselves a chance, or when they meet, it's not the time when the egg is coming out. It's the wrong time of the month. After all, it's only 1 day in a month or 2 days in a month when a woman can get pregnant. Catching it on the sweet spot. In such areas, rather than being investigated for infertility, there are tests you can do to say when the egg is coming out. You can do a urine test, which is quite easy to do. And you time your outstation visits so that those things, what needs to happen will happen at the time that the egg is likely to come out. So it's a question of timing and what you do according to your own personal circumstances, in addition to age. And if you got endometriosis, fibroids, of course, we've got to get them treated. Another common condition that now appears is something we call PCOS. Many
Mm-hmm.
people would have heard of that, where a woman has plenty of eggs, but the eggs don't come out of the ovary. For such people, if for 6 months, after 6 months, you don't get pregnant, certainly you should go for help to get the eggs out to increase the chance of pregnancy.
Brilliant. That's loud and clear. Thank you so much, Dr. Alex. Now, before I move on to the legal side of things with Mr. Fu, is there anything, any final remarks that would you like to say with regard to these ART methods or infertility in general, Dr. Alex?
Okay. Just very quickly about talking about IVM and things like that. I must also explain there's one major issue there. As we talked about, we get embryos, we've frozen them and kept them, and if you don't use them, what do you do with them? They're thrown away. Now, is that right? How long do you keep them? Who owns the eggs? I think that's probably will be discussed under the medical legal section of this conversation, but it's something that we need to understand even if we don't participate in them, because a lot of that time we are counselors for other people, not necessarily that we are the only ones who are the consumers of the information that we have. So having correct information as a public, as a knowledgeable public, is important for the community as a whole.
Brilliant. Thank you so much, Dr. Alex. We will probably direct some questions also to you as we go along. But for the moment, I'm going to now move on to Mr. Christopher Fu for the legal side of things. Good morning, Mr. Fu. Perhaps if I could first start with, maybe if you could just brief our audience, what are the applicable statutes or the common law principles that would apply to the issues relating to the sanctity of life or conception? So we're talking about egg freezing, IVF, surrogacy. Some have mentioned abortion in the comment section as well. Mr. Fu, over to you.
Thank you, Charlene. Actually, that was a brilliant opening question, because I was going to start off this little conversation of mine with a statement that there are actually no written laws in the country, in Malaysia at least, expressly governing the use of ART, or assisted reproduction. As far as I've been able to establish, the main regulatory framework for assisted reproduction in this country are the guidelines issued by the Malaysian Medical Council, okay, the MMC. They have got a set of guidelines issued in 2006 on assisted reproduction. And I wanted to start off by reading. I know we lawyers tend to read a lot from authorities, the way we submit in court. Okay, and these guidelines have been drawn up according to certain principles. I know there are two doctors here; they would be much better placed, okay, to comment on this. But I think for the rest of our audience, okay, I think it's important to set out these principles behind these guidelines, which basically, as I said, okay, represents the main regulatory framework for the use of ART in this country. Okay, so this is what the MMC has said. Okay, now in drawing these recommendations, okay, and the word used here is recommendations. Okay, this is not these guidelines are not law. Okay, they may render a medical practitioner, a doctor, they may open a doctor to disciplinary proceedings, but they are not law in the sense of having been passed by Parliament. Yeah, in drawing these recommendations, the following principles have been used as a guide. Number one, the respect that is due to human life at all stages in its development. Number two, the rights of people who are or may be subfertile and the proper consideration of their requests for treatment. Okay, the rights of the patient. Yeah. And number three, a concern for the welfare of children who cannot always be adequately protected by concern for the interests of adults involved. Okay, so you have to look at the what all this is going to do for the child as well, not just the interests of the parents who want children. Okay. Number four, recognition of the benefits both to individuals and to society which can flow from the responsible pursuit of medical and scientific knowledge. And number five, which I consider to be the most important principle and the overriding consideration, is this: the sanctity of marriage and the importance of marriage prior to having children is a widely held belief by society in Malaysia. The difficulty, okay, and this is where doctors will comment on, will agree with this as well. The difficulty of forcing potential patients to prove their marital status and maintaining constant checks on their status must be realized as a practical difficulty for medical practitioners. A couple comes in and says, "We are married." Okay, I don't know how many doctors are going to tell this couple, "Prove it." Right? They will probably just take their word at it. I can see Dr. Juliet smiling. Now, be that as it may, in this country, assisted reproduction techniques must only be offered to married couples. Okay, this is the last of the 5 principles governing the recommendations made by the MMC. But in this set of guidelines, in the very last section of the guidelines, section 15, which is on prohibited or unacceptable practices, one of the last of these unacceptable practices or prohibited practices is this: it's the use of ART in unmarried couples. So medical practitioners are told point blank that ART or assisted any forms of ART should not be offered, should not be used for unmarried couples. Right? Now, Dr. Alex Matthew has spoken on some of the types of assisted reproductive technologies or involved, okay, that are available in this country. And he said that whatever is available elsewhere, they're all available here as well. I won't touch on each of them, okay, but generally speaking, from a legal perspective, okay, there would be no legal complication if at the time the child is born, the parents are married. Okay, that's a question of illegitimacy. Okay, that would be a question of legitimacy. So if these guidelines are followed very strictly, for instance, if the patients If the two persons are already married, okay, at the time a child is born, then there would be no issue of illegitimacy. Okay, issues of illegitimacy. Okay, an illegitimate child is generally considered to be a child who is born outside of wedlock. At the time of birth, the parents are not yet married. Right? Under the civil law, it is possible to so-called legitimize the child by subsequently getting married. But at the point of birth, if the parents are not married, then the child is considered illegitimate. And illegitimacy, as we know, okay, can lead to issues relating to inheritance, for instance, other than aside from attracting social stigma. I was going to say social distancing. The word comes together with social. Okay, there are social stigmas attached to being illegitimate. Okay, and becoming and that could lead to other issues there. Okay, having said that, okay, um, although the guideline says ART has to be offered only to married couples, there is one form of ART which necessarily involves a third party. Okay, and that is surrogacy. All right. I had a call from somebody to mention to ask me to focus a bit more on surrogacy, and this is what I intend to do, because I think it is in this area of ART that most legal issues will arise. Okay, surrogacy basically, okay, as explained in the same set of MMC guidelines. Surrogacy is an arrangement in which a woman agrees to become pregnant and bear a child for another person or persons and to surrender it at birth. Now, the guidelines by the MMC also say this. This practice is not acceptable to most of the major religions in this country. And such a surrogate pregnancy can also potentially lead to many legal dilemmas for the persons involved. Okay, so what are some of these legal dilemmas? Okay, this is what I propose to go on next, unless at this point, Charlene, you already have some question for me.
No, actually, Mr. Fu, I was the question that's come to mind, and I was going to ask you some practical questions. Was this? What's the legal recourse? You ended with surrogacy. What's the legal recourse that's available? For example, if there is an arrangement for surrogacy, and the lady who's carrying the child suddenly decides, you know what, I've grown attached to this child, and I don't want to give up the child. Can she do that? Number one, and number two, what are the legal implications of that?
All right. This is exactly what I was going on to. Okay, before I hadn't started yet. Okay, I was saying, there are the legal issues mainly concern or mainly will arise when it's a surrogate arrangement. Okay, now as I explained just now, a surrogacy involves well, some people call it a womb renting. Yeah, renting a womb, and surrogacy can take two forms. One is complete surrogacy, okay, which means the male cell and the female cell, okay, are donated from the parents, and the embryo is implanted in the surrogate mother. Okay, in the second version, it is the surrogate mother's eggs which are used. Okay, so there are two versions basically. Okay, typically there would be some agreement drawn up, and Charlene's question really it really is asked in this way if asked to a lawyer. Okay, how enforceable is a surrogate agreement? It's an agreement for surrogacy. How enforceable is it? Okay, typically it will take the form of, it's a promise for an agreement, or a contract is an agreement for an agreement, a promise for a promise. I promise to pay you some money, you promise to bear my child, and when the child is ready to be born, the child is delivered back to me. I may pay for your upkeep, nursing, medical care in the meantime. Okay, I may even agree to pay a sum of money upon success, upon the baby having been successfully handed over to me. All right. The question is, how enforceable, okay, would this kind of agreement be? Right. What if the woman, as Charlene said just now, what if the surrogate mother decides not to hand over the baby? Can the parents, right? Can the parents who entered into the arrangement with the surrogate mother go to court to enforce this agreement? Okay. There have been several cases, okay, and in leading, there's no Malaysian case, okay, there's no Malaysian case, but there is an Indian case which has come up quite often in many articles, okay. I don't know why this case is called Baby Manji Yamada, okay. The name of the baby apparently has been named as well, has been included in this case, okay, but it's a case decided in India in 2008. And there, such an agreement was struck down as being against public policy. In that case, the surrogate mother wanted to hold on to the baby, wanted to keep the baby, and didn't want to hand over to the parents because the surrogate mother had formed an attachment to the baby, an emotional, sentimental arrangement to the baby she had carried in the womb for 9 months and refused. Okay. And the court said this kind of arrangement is against public policy. All right. In Malaysia, in our Contracts Act, okay, there is a specific section in our Contracts Act, 1950, okay, which says that any agreement entered into and which is against public policy or for an object which is against against public policy is void. That's Section 24E, right, of our Contracts Act, would render this kind of a policy void, okay, as being against public policy. But why is it against public policy? Okay, what is wrong in making such an arrangement? You may want to ask. Okay, there is another case, okay, often referred to as the first ever case which has been reported involving surrogacy, and this is the case of Ree Baby M. Okay, the case of Ree Baby M in New Jersey, in the USA. There was a 1988 case, right, and there the same principle of public policy was also applied. Now, why is it against public policy? Very briefly, that case touched on many, many issues, but the main issue coming out of that case is that it is against public policy to trade, to buy or sell a baby. I think common sense, okay, a basic sense of human decency would tell us that, you cannot really engage in any commercial transaction where a human life is the main concern. Okay, and that is why a surrogacy arrangement, okay, would be considered to be against public policy, and which is why such an agreement would be void. All right, at least in the eyes of the law. Okay, but then again, okay, what if all the parties, both parties, the parents as well as the surrogate mother, if both parties are not going to object? Okay, both parties. I mean, if you go to the courts, if either one of the parties to this agreement decides to renege on it, for instance, the surrogate mother doesn't want to hand over the baby, or the parents don't want to make the payment as they agreed to, then one of the parties goes to court, that agreement will be struck down. Right? But what if everything has worked okay, i.e. the surrogate mother hands over the baby and the parents make the payment as agreed? Does that mean that everything is over? No. Okay. When the surrogate mother delivers the child, okay, probably in hospital, the mother has to register it. Okay, we have a Birth and Death Registration Act, okay, which requires all births to be delivered, to be registered, okay, with the correct information. Now, what information is going to be registered on the birth certificate? Is the surrogate mother going to admit or to say factually that I am the mother, this is my child? She is the birth mother. Correctly, she should be registered as the mother. Is that going to happen? Now, my understanding is that in the so-called black market, and this involves adoptions as well. Okay, very often I don't want to pass judgment on this, but I'm just mentioning this as an established or frequent practice. Okay, doctors are prepared to certify that in fact the birth mother was somebody else other than the actual mother. Okay, I think we've come across instances like this. Okay, now, so we want to ask whether this is good practice or not.
And and Mr. Fu, if I could just interject there, where you mentioned the phrase, whether it's good practice. I just want to ask a few quick fire questions to you, if that's okay, on this issue, whether this is good practice and from a legal perspective. So, for
Sure.
example, if a couple goes to a fertility clinic and they say, I want you to store my eggs. And I want you to store them for as long as that's possible until I give you instructions. From a legal point of view, are they able to have that sort of contract that's almost perpetual?
No, I think here that the two doctors on our panel will also confirm. In fact, the MMC guidelines, for instance, okay, also I think they specify how long eggs can be stored for instance, when you have embryos, okay, or even how long the storage is for. But if it's like forever, I don't think there is uh, um, anything, I don't think there's anything that would allow a doctor to store forever.
In perpetuity. Right now, on a related issue, and actually this is something that has actually happened in real life. So a couple goes for fertility treatment. One passes on. Now, does the living partner have full say as to what happens to the embryos that have been gathered from both of them through the fertility process, or
Absolutely.
go
Yeah,
ahead?
absolutely. It would be just like a normal, it would be just like a normal situation. Okay, before birth, okay, I can't say the mother dies. Okay, before birth, the father dies. Okay, so the child is born to the mother, okay, as a single parent, because the father has died whilst the baby was in the womb.
Yeah.
There's no,
So
there's,
so
there's Yeah. But in terms of being able to give instructions,
mm,
both parents are the joint patients, yeah, shall we say, for the doctor. Okay, well, if one of them has passed away, it's obviously the father, because if the mother has passed away, then that's it. The mother is the bearer of the embryo anyway. All right.
and
The doctor will be taking instructions from the mother.
correct. Yes, agree. And are there any cases, either reported or otherwise, interesting cases from which on the issue of infertility or assisted reproductive techniques, which we can draw lessons from, Mr. Fu? It doesn't have to be Malaysian cases. It could be from any other jurisdictions as well.
Sure. No, well, I'm not aware of any involving ART, but certainly in terms of surrogacy, I specifically mentioned surrogacy just now. Okay, in Malaysia, although we have no cases, we are likely to follow. Okay, we are likely to follow the decisions from Commonwealth, from other Commonwealth jurisdictions, and the case of the Indian case I mentioned just now, the case of Bibi Manji, for instance. Okay, our courts are likely to follow that and apply the principles of public policy. Okay, but what I wanted to talk about, okay, I wanted to clarify or expand a bit more when I was talking about the registration. Okay, there might be some falsification of documents involved. Okay, who is going to be registered? Okay, as the lawful parents or the legal parents? Okay, legal parents of the child. Okay, because if the registration is done correctly, the surrogate mother will be named as the mother of the child. Okay, and if the surrogate mother is not married, okay, the surrogate mother has the choice whether to name the father or not. The child is
Yeah.
illegitimate. The child is born illegitimate because the surrogate mother is not married. If the surrogate mother is married, okay, and we wouldn't discount this kind of a possibility, because the surrogate mother and husband may be doing this for the money. They may need money themselves, for instance, to look after their other children. All right, then the child, okay, that is born to the surrogate mother from the egg and the sperm of the actual biological parents, okay, would be deemed in law to be the child of the surrogate mother and the husband of the surrogate's mother, okay, by virtue of Section 112 of the Evidence Act. Okay,
At
that
this
child.
juncture,
Hmm.
Sorry, at this juncture, Dr. Clarence, do you have a question for us?
Father Clarence.
Yeah.
Sorry, Father
Yeah.
Clarence.
Sorry.
So many
you're
doctors
so
in the house.
you're so many people all around. Yeah. No, I just want to jump in and ask, because just recently, and I would address this question both to Christopher and Alex. Um, Recently, I read, with the mushrooming of so many fertility treatment centers in Malaysia, they're popping up everywhere. Let's leave aside the business aspect of it. Uh, Medical tourism seems to be something that's being promoted very much in Asia. And I right here now, I'm in Bangkok, and medical tourism is a big thing here. I read an article saying that Malaysia could be a center for fertility treatment in Asia. Now, I'm just wondering, listening to Christopher saying that there aren't much laws to govern these things. So it's like, it's in a state of flux. It's a lot of ambiguity. Now, that gives an opportunity for all these centers to open up, and maybe to Dr. Alex also saying that, are there ethical principles that govern these things? Uh, are there laws that govern these things? What's happening in these centers? Who is looking at them, or is it a free for all kind of a thing? Because people go to from place to place, they jump from place to place, and I see that. Say, Father, I've gone here, I've gone here, I've gone there, and everybody gives different advice. At the end of the day, it seems to be a situation of, so are there laws, or does the MMC or MMA have they got ethical principles about fertility treatment here in Malaysia?
Dr. Alex, do you want to deal with this first, or shall I? I think you're muted, Doc.
No, we still can't hear. Perhaps, Christopher, you want to go first while we
Yeah,
sort that out?
Father Clarence, the fact that all these fertility clinics are just mushrooming, as you say, in the office where Charlene and I worked, okay, on the ground floor, 2 or 3 clinics, just like that. Okay, now the fact that they're openly being set up, okay, must suggest, okay, I mean, the authority, and we have lots of complaints about our authorities, our police, and so on, okay, but they can't be blind to all this. They know this is happening, okay. The very fact that they exist and are carrying on a practice in fertility treatment must mean that, look, this is allowed, okay. But how, it's really a question of how they carry out the practice and how they put into this practice, and this is governed by the MMC guidelines. Again, always the MMC will take action, okay, only if there are complaints maybe, or if word comes to the MMC that, that guidelines have been breached, for instance. If nobody complains, okay, or if the MMC does not know that there's been a breach of the guidelines drawn up by the MMC, the practice will just carry on.
And
Okay,
if I
if you're
could,
talking about
sorry.
ethics, Father Clarence, okay, really, uh, ethics here, okay, depending on which side you're on, and perhaps even depending on which religion you subscribe to, okay, ethics would be looked at from quite different spectacles. Okay, which tint of rose are you going to employ?
And on that note, actually, Mr. Fu, Father, if I may just interject, just very briefly only, from one of the cases, I also do medical legal work, defense work, actually, and to answer that question, one of the cases which we had actually involved an IVF case. It's concluded now, where there was a mix-up in the gametes, right? And they implanted the wrong embryo actually into the couple, and I usually do defense work, but I was actually acting for the couple in that case. And one of the arguments that because there, as Mr. Fu said, there isn't specific statute or laws in Malaysia to govern IVF. What we argued in that case was that because the fertility center prided themselves and they marketed themselves to be internationally accredited, right? And so what we did was to get an expert from the international body to come and testify in court that these are the standards that have been approved and passed on by the accreditor. And therefore, by virtue of the fertility center being accredited and affiliated by this international body, they then should be held up to those ethics, those standards. But I think it would be really helpful, I think, if the MMC, and on this note, I actually pass it on to Dr. Alex now to come up with specific guidelines actually on the ethical issues, in addition to the one that Mr. Fu has already pointed out. Dr. Alex, are you able to hear us and speak now? Right, so we can't hear you. It's okay. We'll probably get some.
Yeah, perhaps Dr. Juliet has something. Yeah, maybe she could say something. Does MMC have any guidelines on these matters?
Good morning, everyone. Father, you're right. There is guidelines. I'm no expert in this field, but what I can say is that these things are taken seriously when it comes up to MMC's level. That means there are panels and panels of discussion. There are doctors sitting in at higher levels to discuss this. So if it comes to a complaint from the society or the public or the community, then it is digested very seriously. Right? There are guidelines. Mr. Christopher has said that before. There are specific guidelines on ART, on infertility treatments. But again, how far of it is open, how far of it is transparent is another thing we need to consider here.
Yeah, just like what Charlene was saying. I mean, if nothing goes wrong, nobody talks about it until and unless something goes wrong. Then it's highlighted, isn't it? I mean, in that sense, I just always used to wonder, because I see a lot of people who come and ask these questions, which I'll talk about a bit later. And I keep hearing that, if one doesn't work, they move to another treatment center. And every time is a different kind of an approach and advice. At the end of the day, it's financially draining for everyone. In that sense. No, I just wanted to know. So that's why I said, when I read that article, said Malaysia is going to be a hub like for Asia. We don't have clear guidelines. Well, who's going to regulate these things? And I was just wondering whether this is something that we should be concerned about.
Yeah. Father, maybe if I just make this one statement, there is a regulatory framework. Okay, as I mentioned right at the start, there is a regulatory framework. And this would be the MMC guidelines on the AR, artificial reproduction. The issue, as I repeat, is really one of enforcement and whether or not there are any complaints. Okay, if nothing goes awry, if everything goes well as planned, nobody will complain. It's only when things go wrong, as in the example that Charlene gave, where the gametes are mixed up, for instance, okay, then you might have a legal issue, okay, as to whether or not there was negligence and what should the compensation be. Obviously, in such cases, there would also be the emotional side of things, the sentimental side of things, okay, whether or not those feelings can be compensated. Okay, it's a very private area of, it's very private area, children, fertility, okay, and people generally do not want to bring this out into the open. So in fact, my own suspicion is that there have been many cases where things have not gone right, okay, but because of the very private nature of the treatment, okay. For instance, if the history goes out, for instance, the man, the husband has got an ED problem, erectile dysfunction problem, for instance, okay, that's not something that he may want to be disclosed. Or if the woman is not well for some reason, okay, these are not issues that people would willingly want to be shared in the public. And this would come out in the public if the matter goes to court, for instance. Okay, so there are sensitivities involved. Okay, and some even religious. Okay, I mean, if I were Catholic and if I were a staunch Catholic, I'm a church-going Catholic, for instance, I could be on my parish council. Okay, but if I went for IVF because I do so badly want to have a child, okay, I mean, on the one hand, I know this is against my religious teaching, but I do so want to have a child with my wife. Charlene.
Yeah,
These
no,
are
no,
difficult questions.
absolutely,
Mm,
absolutely.
mm.
Dr.
See,
Alex, you're back here. Do you want to try one time or one more time? You are muted at the moment, Dr. Alex. If you could just unmute and let's try and see if we can hear you. Oh
Oh,
dear.
we have
Okay,
lost
we've
him.
just lost him. Yeah, no worries. We'll try again when he comes back. And I'm just going to tag on from something Mr. Fu said. There's also that emotional side of things that often come into play. And on that note, I'll very nicely move on to Dr. Juliet. Dr. Juliet, now, we often read and we hear about, couples' journeys through infertility and the struggles that are associated with that journey. Now, from a psychological point of view, could you share with us the psychological effects on those who are having difficulty conceiving?
Yes, that's my expertise, Father. Right. So the psychological effects are multifold. I mean, it starts from the beginning, right after marriage, about a year itself, you have that social pressure here to conceive, and when you're going to have a baby, when you're going to give us a grandchild, so that it starts from the beginning, right? The psychological effects. I would just categorize it, or rather distribute it into many folds this way. It starts with enduring, trying to understand why it's not happening. We are trying. Why is it not uh, becoming a child? Why I'm not having a child? And then from then onwards, the embracing of it. Is this infertility? Is this an issue of infertility? Am I going to have some challenges, trouble in conceiving? Right. And then from then on, it's moving on to coping with the fact that, hey, we can't have a baby, and learning to live with it and moving on. So the challenges, if you ask specifically, differs from each individual, right? With each individual, it's different kinds of personality, conditioning, and the social structure around these folks, right? So the psychological challenges that can come up depends on the support system as well, right? And how they cope with it. And it can be multifold. It can start with what? Anger, frustration, sadness. It can be the feeling of anxiety. I've had patients telling me that every time the couple who come in and say, my wife, every time she gets her period, she just blocks herself. She goes into a room and she never comes up for a few days. It's a sign that this time it did not happen, right? So we're talking from various aspects, from low mood, depression, anxiety, the feeling of hopelessness, and finally, depression. And when depression sets in, that's when the uh, whole thing goes haywire, right? So there's a lot of mental engagement here. The fear of, is this ever going to happen? Have I let my husband down? Or in the sense for the couple, right? Have I let my family down? We're not producing children, right? And from there on, it goes on to anxiety. So when it comes to the treatment part, and now we're talking about infertility treatments and the multifold mushrooming everywhere, hopping from one to another center, as mentioned, it's all because of that hope that somewhere along the line something will work and we will get a child. And that itself is a psychological journey, a trauma, a mental torture, you know. And at the end of it all, there's also this feeling of regret that so much has been spent on this kind of treatment, uh, and I'm not, we are not successful at it, right? So, in a nutshell, I would say this, Charlene, that it depends on the individual and the couple how they face these challenges, right? There's no one particular way of putting this, but it depends really on the couple and how they're enduring it, and a lot to do with the social cultural context of pressure here, the family.
Very nicely put, Dr. Juliet. And I think, you mentioned that, it can lead to, anxiety, depression, and things of that sort. And these are terms which are quite common, actually. You hear people talking about them. And they are as a result of, perhaps the sensitivity that resolves or revolves around this issue. Now, the next question I have is this. What are some of the signs and symptoms? We throw the word anxiety out very commonly. We throw the word depressed out very commonly. But what are the signs and symptoms to look out for in order to gauge whether or not we require any emotional or psychological support? And I'm talking about professional support, rather.
So the family around or the partners per se can look out for the signs and symptoms that you're asking me to define here. Again, depends on the individual. If there is any change in the normal personality behavior, that's a red flag already. You know, if there's any change in the routine of having what we call pleasure mechanisms, seeking out pleasure mechanisms, going out for food, hanging out with friends, then that's another red flag already. It's again multifold, but the person closest will be able to identify it, right? Will be able to pick out, hey, this person is not doing something that is usual, or this person is always in the room, not mixing around. This person is crying at the drop of a hat at every single little remark that we make regarding this. Then we're talking about a change in personality. Then we are concerned, right? Our society can actually be a bit cruel because we are very family based. So imagine a couple just got married, and then within 6 months, we're not seeing a pregnant belly. Uh, the questions start coming out from the family members, the friends, the neighbors. And then when that gets into this person and they start reacting, that also becomes a red flag already. There's some sensitivity issue here. Yeah. And so how a person copes with it is multifold again. Different personalities will, able to brush it off and just go on and say, hey, when the time comes, the time comes. But then others will break down and cry. Then others will snap angrily and say, stop asking me all this. Why do you have to ask me about, marriage is not all just about a baby. So there's different red flags that you need to identify, but the person closest would be able to do that and should look out for these signs. I hope that answers your question, Charlene.
No, absolutely. I think it's good that you point out that it's actually subjective to each individual, and the people really who should be on the alert. I mean, everyone, of course, but those who are closest to them would probably be in the best position to sort of nudge them in that direction. And just tagging on, Dr. Juliet, you're a registered counselor, and I'm just wondering, for couples who check on their fertility, are they usually offered counseling in the private and the public hospitals, or is that not the practice in Malaysia?
Actually, that's a very good question to ask Dr. Alex.
Oh, yes.
All
Is he?
fertility centers have a registered counselor there. I'm not sure, but there is a counseling unit in every hospital. Every hospital, whether it is routinely, it is routine for them to send them to counselors, not is Dr. Alex to answer. In my practice, yes, I do get married couples who come in after a few years or 2 years, voicing out that, we have tried. The guilt comes in, we've been concentrating a lot on our career and, buying that house and settling in life, that we have not had time. And now that we're trying, it's not happening. I've had that. And I have referred them, of course, for the infertility follow-ups and treatments. My role would be to be there to advocate their emotional aspects, to make sure the regrets and the guilt go off the picture, right? Yeah, so that's my role. But to answer your question, I know that every hospital in Malaysia now has a counseling unit, but whether infertile couples are set to that as a routine, I'm not so sure. Or whether they are only sent when they see the red flags and they decide, these people need counseling. Yeah.
Do you think they should be counseled from the get-go, Dr. Juliet?
Yes. There's
Yeah.
something called medical counseling, and that goes on invariably with all doctors,
Yeah.
right? So every patient who walks in that door is given counseling by the doctors. whether they're taking treatment for anything at all. The counseling is there. It's part of your management and treatment. How good one does from the other, well, that's subjective again. But that's part and parcel of treatment and management. So I believe the specialists in this field are doing that already, counseling them about the effects, the side effects, the hormonal changes, the sleep changes, the patterns. It's being done. Now, if you're
Yeah.
asking me if they should be sent for anything extra and special and if it is available, I'm not sure.
Okay. And Dr. Juliet, a lot of times, at least from the Asian perspective, where we're quite private about the struggles that we face because of perhaps societal pressure or, issues which are regarded as taboo, for example. Now, revolving that is the issue of confidentiality. So sometimes people don't want to seek help because they're afraid, someone might find out or someone might see me going to see this person. So with regard to counselors, I think confidentiality is really a very important issue in the profession. Can you just talk a little bit about that and how you can instill confidence in the public with regard to their concerns regarding confidentiality?
Well, that's why we are professionals in the field and we take consent before any procedure, any sessions. So that's why I generally tell a lot of my patients and friends and family, whoever I can, to seek the professionals in the field, the certified counselors, the registered doctors, right? Then the confidentiality issue is well covered. We are trained and we know we cannot talk about it to anyone else. Now I'm worried when you go to a what counselor somewhere who's not registered and you're talking about all this, then I'm worried that everyone in that community is going to hear about it, right? So when it comes to confidentiality, MMC has got clear guidelines on that. And our Lembaga Counseling Malaysia has got clear guidelines on that. We cannot breach that. And we have to take formal consent from our patient before we start our sessions, before we start our consultation.
So
Right?
the message out there really is the information is safe with us, right? Um,
Definitely.
yeah, and also the next question that might be playing on the minds of the listeners and those who watch this later on would be like, where do I start? Where do I go if I need help? Do I see a psychologist? Do I see a gynecologist? Where do I go?
So in cases of infertility, of course, everyone goes to the gynecologist first, right? They're the experts in this field. And like I told you earlier, it is the gynecologists, the doctors, they have counseling within their skills as well. And they would know best what to do, how to address the situation, how to tell you what to look forward to, what are the side effects, even emotional, right? But if you need more help, to endure to go through the whole process, more help, for example, one partner is feeling a bit too emotional or a bit more, we call it situationally distressed, then yes, seek a counselor's help or a psychologist, we call it, but a counselor's help to help you. I just want to educate everyone here that having infertility problems and having emotional effects due to that is not a disease. It's a situational distress. And so you do not need medications, you do not need to be treated, but you need to be journeyed with. You need to be supported, right? So here, I would say in many cases as well, in many other cases as well, there's no need for psychiatric help. Yeah, you need someone to sit with you and listen to you and counsel you and journey with you, right? So the gynecologist will do that. That's the best person. And if you need more help in that field, you need more frequent sessions. You need to talk more about it outside the gynecological aspects. Then look for a counselor.
That's brilliant. And I think the important point there is that we have to be supported in the journey, right? And I think piggybacking on that point, all of us at some point may be a source of support in someone's journey. And so my question to you, Dr. Juliet, is this. Let's say if a sibling, a friend, or a relative, confides in us and says, I'm having this issue, and I'm in this dilemma, and we'll discuss this later with Father Clarence, I really cannot conceive. I want a child so desperately. I want to resort to IVF, but I know that's probably not, approved by the church. And they just want someone to hear them out and someone to speak to. Now, if someone approaches us and they're in that situation, how can we show? How do we support them?
You supporting multifolds. One is be a listener. If there's any emotional aspects to that, you want to just be a listener. The other way is the other route will be to send them to the appropriate experts who can do what is necessary for them, right? So here they can go to their first primary care physician and talk about it. And a primary care physician will be able to tell them whether it is an infertility in the first place, or you need more time. The basic aspects of it, a primary care physician would be able to advise this person on that. And from that, whether this couple needs to go on to see an ONG specialist. Right now, from the friend and relative and supportive point of view, I go by You've heard of Ronan Keating, isn't it, Charlene?
Yes, I have.
Yes. So you say it best when you say nothing
Say
at all.
nothing.
Yeah. You
Right.
just listen, be present, and be congruent. I mean, be real. Don't give advices that you don't know anything about. Just be real. Sometimes they just need people to listen, talk about it. And the rule in counseling is that when a person talks, they actually form the answers within them.
Yeah.
And also, they just need a platform to voice it out, to talk. So they actually just need listeners.
That's so interesting because a lot of people think that, to be a good counselor, you need to be able to be someone who speaks well, someone who knows the right words. But really, the art of counseling, or rather, it sounds as though the heart of counseling is to be a good listener, really. Yeah. Okay. And when you said that, one of the other things, and I think it's so important as well, to direct them to the appropriate experts, right? So, for example, if someone needs counseling or psychological support, is there a website, a registry, or a place where they can look up those who are certified or those who are registered? Because for a layman, it might be a bit difficult for me to know whether a certain person is registered or not, or certified. It might be a bit awkward if the first question I'm going to ask is, are you certified or are you registered? So how do they go about that?
Well, thank God for the internet era. Now you can
Yes,
just check it all online and see if so and so. Because in counselors also there are doctors. They call themselves doctors because they've done their PhD and masters, and they're experts in the field. So you can actually check it online. And most centers in Malaysia that do give counseling services do have that list. You would call up and ask them straight, look, I'm looking for a registered counselor. I would like to know the counselor's, we call it a PA number, or
Okay.
a KB number, which is counselor berdaftar number. And you
Right.
can look it up, whether this person is registered in the LKM portal, Lembaga Counseling Malaysia portal.
Okay.
Right.
That's
And that's a very fair question, very important question for all the audience here, because we want the registered counselors to do this, not anyone. Yeah.
Thank you, Dr. Julia. That's most helpful. So the official LKN, is it?
Lembaga Counseling Malaysia portal.
Portal.
Yeah.
Okay. And just before I move on to Father Clarence, do you have any sort of if there's a message that you want to convey to those who are journeying through infertility, what would you say to them?
My husband and I had infertility problems. So this is so apt for me to say this, I think. It's difficult. It's not easy, right? Somewhere along the line, it happened and it happened. But before that, the turmoil, the frustration, the sadness was devastating. And then there's a social culture here, right? When? How come so long? You all are doctors also cannot. What's wrong? You know, that stigma, that shame, that regret. I wish all these couples out there patience, right? The patience to endure this. And when the time is right and it happens, it happens,
Mm, mm.
right? And if it doesn't, my point of view, it's God's journey for you.
Brilliant. Thank you so much, Dr. Juliet. That's very lovely. We'll now move on to the fourth and final speaker, Father Clarence. None other than you, Father. Thank you so much for agreeing to speak with us today. Now, if I could perhaps start the conversation by posing this question to you, Father. Now, we know that the desire to have children is an innate need, right? In fact, when I remember when my husband and I were preparing to get married, part of the CMPC course was, there was one section where we were told, you have to be open to having children. That's the Catholic teaching, right? And then again at your wedding mass, that same questions asked by the priest, and you have to agree to be fruitful, right? And so when couples find out that they're having difficulty or they're unable to conceive naturally, right, they're often saddened by it. And the question, I think, the foremost questions in their mind is, why me, Lord? Why have I been singled out? Well, they're probably aware that others are facing it, but sometimes that journey can be very lonely. And what's the church's response to that question, Father?
Thanks, Charlene. Literally, you put me in the corner now, and it looks like I'm going to be the bad guy now with not the good news but the bad news. It almost seemed like that. No, but and first and foremost, thanks to Dr. Alex, Christopher, and to Juliet for this enlightening conversation that we are having this morning. I think first and foremost, before I answer your question, I think we need to recognize that the idea of fertility, or we've been talking about infertility. It's a very complex issue. It's not as clear, as straightforward as we would like it to be. Like Dr. Juliet said, right? I mean, there is societal pressure. You don't have you're married 1-2 years, and you go to a wedding function, and your dear grand aunt was just saying, "Oh, yeah, when are you going to start a family?" That puts pressure. So we recognize, as church, that this is a complex issue. It is not just medical. It's not just legal. It's not just social, but there's a spiritual dimension to it also, to all of this. And you rightly said, firstly, the thing is, you said that in the Catholic marriage preparation course and in your wedding day, you are being asked the question. Let me just be very clear. I think that the question here is, is it a right to have a child? Or the question is now, is it we are open to having a child? So we need to distinguish that a bit. So I think one of the questions that would be asked is, will you accept childrenly, lovingly from God, and bring them up according to the faith? So you being a lawyer, when you say is, will you accept, in the sense that that there's a giver here, and the giver here is God, and God gives to whom He chooses. Now we can have a whole debate about why God didn't give me and gave somebody else. Am I less worthy than another person? It's a very complex situation. It's just like someone falling terminally ill. We're always asking that question: why me? Why me? I mean, you have questions like people who have been serving in church. We have priests. You look at Pope John Paul II towards the end of his life, suffering, Parkinson's, and he would have asked the same question: why me? I mean, I'm the Pope after all. Shouldn't I be preserved from all this pain? And shouldn't I'm the head of the church? He should be saying, God, why is this? And I think we need to recognize that the frailty of human life. That's one thing. That we are all, we are perfect and imperfect at the same time. And the whole idea of, you talk about infertility or fertility, it's a gift from God that we want to talk about. That God is the primary giver of this life. I mean, I jokingly say, if you want to ask me why, I think when we meet God, you ask Him face to face, lah. You either you put Him in a corner and say, God, why me? But there are many questions that we ask, and the whole idea is to recognize that God is the primary giver of life, and we are talking about issues about at the beginning of life, and it's the same issues that we deal with at the end of life, issues of end of life. If God is the giver, then God is the taker also. Maybe perhaps we'll have another forum to talk about end of life issues. And so it is a gift. It is a gift that is given to couples. Is there a criteria that God looks for? I can't answer for him. If I knew God's mind, then I would be God. Then you should worship me. But I don't know his mind. But we recognize that the aspect of human frailty, that we will get sick, we will have difficulties in certain health issues. And having said that, we talk much about so if it's a gift of life, aptly the whole idea is life is holy because it comes from God. Anything that comes from God is holy. It cannot be otherwise. So we talk about sanctity of life, the sacredness of human life, and that is something that a very fundamental principle in the Catholic Church's teaching. Whether it's the issue of bioethics, or whether it's the issue of human rights, or any issue that you're talking about in the Catholic Church, the fundamental premise is that life is sacred. And because life is sacred, it has to be protected. It has to be, guarded, either by the individual or by society at large, or the church also. So when we talk about ART, some people come and say, Father, why is the church not compassionate? I want to have a child. Why isn't the church? What's so wrong? I mean, what's so wrong in wanting to have a child? And why is the church? Why is the church showing no mercy, saying you can't do this, you can't do that? But the whole idea is about the protection of human life. And when we talk about marriage, there are two aspects of marriage. And I'm sure, Charlene, shall I put you to the test or not? Whether you remember your CMPC answers or
Please
not?
don't, Father. Please don't. We're here to listen to you, not me.
So, there are two main properties of marriage. One is marriage is unitive. It's the husband and wife, And the second aspect is it's procreative, that children. Out of this union, God blesses children. So it's the unity of both husband and wife, the fruit of their love, that you have the child. So the question is, that's why when we talk about assisted reproductive technologies, it's in the strictest sense, it is not a fruit of that union, because now there is a third person in all of this. All right. Whether it's a medical technology that assists you, or something else that assists you. But the whole idea is the fruit of the union between husband and wife. Now, there are other ethical issues with regard to, I think Dr. Alex has mentioned about IVF. We talk about IVF. There are so many other technologies that are available out there today. And I think the most often that we hear about is IVF. So the question is, one is also accessibility. So the question, when you talk about Catholic social teaching, I start from there in the sense that it's only accessible to the rich, right? So there's an inequality, the starting point, with regard to accessibility. So I'm not just talking about reproductive health, but in other issues too, whether there's an equitable distribution of health resources to everyone, whether everyone has the possibility, to be able to get the counseling that Dr. Judith talks about, or whether guidance that we talk about, do we have that? So the starting point seems to be, I don't know how much it costs, but I know they are very expensive. These fertility treatment centers are terribly expensive, and it eats into many people's savings. Secondly, the question is also the technology. A lot of people think, Father, IVF, what's wrong? After all, I have a child. But the reality is that there are also many other eggs are fertilized. Now, from the Catholic perspective, is that when does life begin? Life begins at the moment of the fusion between the egg and the sperm. That's when life begins. Now, this is in Catholic theology that there has been an evolution. Now, if you go back some centuries ago, St. Thomas Aquinas, he would talk about ensoulment. When does the soul enter into a fertilized egg? So that's always been the question that people kept asking. Yeah? So when we didn't have all these technologies and the development of theology was just in its beginning, Thomas Aquinas would say that the soul enters when there's a certain form in the egg that you begin to see a human form in the fertilized egg. So he had this perception that for males it'll be 40 days after the soul enters, and now don't ask me and don't now come after me. For the female, it's 80 days.
Wow.
Don't ask the question why. All right. Why? I dare not even say what I want to say anyway. But that's how theology was at that time, and evolution, like many other things. Even the issue of whether the sun is the center of the universe. There's also an evolvement in Catholic theology, right? We persecuted Galilee for his understanding. So theology has evolved. So today, what we hold is that that life begins at that moment. And it's very hard. It's very there's no. I mean, from the medical perspective, there isn't a scan that can tell you the exact moment when the soul enters. But there's always other theological debates. They always talk about if give you an example, when if the soul enters at the beginning, at the moment of the egg and the sperm being fused, what happens if the cell breaks into two and twins? Is the soul broken into two also? Now that's another question completely. So today the church holds that life begins there. So which means that life has to be protected. Now, of course, there are questions like, what happens? So what happens to these eggs that are frozen? I've had issues. I remember when I was in America studying at the time. There was an issue, I think, in Chicago in one of the hospitals, like what Dr. Alex said. A mother just wanted one, but she conceived triplets, and she was suing the hospital. Because of IVF. So that became an issue. So the question is, what happened? So some people talk about, because of the difficulty, you fertilize many eggs, then you freeze some and you use them when you want. The question is, that's life. It's just as good as putting, your baby into a freezer now, and keeping the baby there, and then asking the baby to come out much later. So these are the ethical issues that the church has. So the question is the protection of human life. The vulnerable, these are very difficult issues. Recently, the whole of the West was celebrating the overturning of Roe versus Wade about the abortion issue. So it's all about pro-choice, pro-life. I mean, that's something else that we have talked about. But the question is, the church always protects the most vulnerable, the voiceless. The church has been at the forefront. So the question is, now you have an egg that has been a fertilized egg. The question is, the church has to stand to protect that, because that is life, and that is voiceless also. So that is why the issues about many of the artificial reproductive technologies, the church says no. It says it is immoral, because the question is, how are they protected? Because from the very beginning, they are being exposed to dangers. They are being vulnerable already. So, I mean, some questions. I mean, we have had this discussion about adoption of fertilized eggs, but it's not been successful in many parts of the world. Being to adopt fertilized eggs. I've had a situation in the past. Somebody who had, frozen an egg to be used later, and so happened that before that egg could be, inserted back into the womb of the mother, she was diagnosed with stage 4 cancer. And so she had this moral dilemma now. What do I do? And because of her faith, she feels like, I'm abandoning. So all these other issues that come up, Charlene, in the sense that that's why the church sees that the protection of human life as the very foundation of our ethics, of our principles. When we talk about conception. Yeah, that's a long answer to a short question.
No, no, that was beautiful, Father. I think it's so important that we hear this. Some of us may be aware, but to hear you, articulate it so eloquently, that's brilliant. I am going to ask the tough question, so I'm going to ask for forgiveness beforehand. What's the church's what do you say, Father, to those Catholics who have undergone IVF or any form of ART, or those who are undergoing it? Yeah, what's the message to them?
Yeah, this is a tough one in the sense that what do they do? I'm not here to put guilt on anybody here. If you have done it, or if you have a child who is a product of IVF. So for the church's position is that the dignity of the child does not depend on how the child is conceived. So it's not dependent on that. So I mean, whether a child is a product of IVF or some other ART or natural, they enjoy the same dignity because life is life. So you cannot have first class citizens and second class citizens. It's not like flying. You fly in first class. Those who are naturally conceived fly on first or business class to get to heaven, and those who are not fly on cattle class. It's not that. So life in any form. So that's why sometimes I'm asked the question. I mean, slightly digressing a little bit. What happens if someone is raped and is conceived? Is it all right to abort? So the question is not the means, how life came about, whatever it is still precious, it is still sacred, it still needs that protection. So the dignity is not dependent on how a human being comes into existence. So the question is, how yeah, it's a difficult one. It's a difficult one. If you have people who have frozen the eggs to be used later, rethink this whole thing. What are you going to do afterwards? Because that's life. That's life being discarded in that sense. I know this sounds very harsh, very hard, but in that sense, it is the role of the church to protect these and to keep them safe also in that sense. So that's why, even before you think about going to, explore these, speak to someone. Because a lot of times, Charlene, I encounter at that moment when the pressure to have a child is so great that, people don't think anyway. So the means, for them, it doesn't really matter as long as the end is that I have a child. So we don't realize that in the process of doing IVF for one child, many other eggs are being destroyed in that process. So, and sometimes these things catch up with you much later. Yeah, I'm sure you asked Dr. Juliet, even people who have gone through abortion. At that moment, maybe they felt the great need, but later on in life, that guilt sets in. And I see so many people, without divulging the secrecy of confession, people can say, I can't reconcile the feeling now of what I did some time ago. So sometimes it's good to kind of talk about it, to address these issues. Don't just look at the now, look at the future, how you deal with it. And I think this is where society plays an important role. That we need to be, even if couples are not able to have children of their own, to be able to be supportive. A lot of them feel the pressure because you are being persecuted by an aunt or by a grand aunt or something like that, or somebody like that, who keeps nudging you at every family function, and then they withdraw from these functions. They don't want to go. So society plays an important role. So this whole issue of fertility, infertility, we all have a role to play in supporting one another, no matter what. So of course, having a child is a blessing. Having a child is a great joy, etc., etc. But sometimes it's God blesses you in different ways. And that's not the only way. People seem to think that's the only way simply because there's pressure from society. There's pressure from everybody. I think Dr. Alex spoke today. People get married much later. Secondly, work stress. Lack of work-life balance. They're not able to conceive. Then you have mother-in-law auntie nagging you every time you see you, that itself can cause infertility, I think.
Yeah.
And yeah.
Yeah, no, no that's a brilliant message. I love what you said, Father. The dignity of the child is independent of the manner in which he or she was conceived, right? Because my next question to you was going to be, what about those those children? And I actually have friends who were conceived through IVF, you know. So to them, the question on their mind is, am I any less in the eyes of the church or in the eyes of God, and I think, the answer to that question is a resounding no. Your dignity is independent of how you were conceived. And I was also thinking of that as a beautiful response to, the argument of abortion, which I think would probably be an issue on its own entirely. When people talk about, what about victims of rape, right? And I think it's also important when you talk about society's role, Father. So as a Catholic, how do we support? What's the Catholic response to a fellow brother or sister, a fellow Catholic brother or sister who's going through this difficult journey? How can we show them compassion and love?
I think, Charlene, the first thing is stop asking them the question, lah. When,
Absolutely.
stop that. You know, uh,
Mm.
I have this joke. I often tell sometimes, and I think I would say this joke here also. I've used this before. So there's the joke is that, so there's this young girl who's getting on in age, in Indian communities and many Asian communities, when they say, okay, when's your turn? When you're going to get married? When you're going to get married? So this auntie kept nagging that young girl. Oh, when are you getting married? Every wedding that she went to. So, are you next? So, are you next? Kept asking the girl. So the girl got quite irritated. Over time she used to avoid. So then suddenly this old auntie and she met at a funeral. And then she nudged the old auntie and said, "Are you next?" You know, and the question stopped apparently after that. So that's the joke I often say.
That's beautiful.
So, but I
But
think this is the what.
sorry, go ahead, Father.
Now then, this is what I think we put pressure on people. Perhaps that's the first thing we need to do. And I think the second thing is, if you have a friend, and a friend, be a friend, be a supportive friend. That person knows that, even in the moments when I'm thinking of withdrawing, that I can go to this person, I can go out with this person and have a chat, have a conversation, and be open to that person, accompany the person in their difficulties. It is, though it's, I wouldn't say it's like an illness, but even, let's say, a friend who is terminally ill, sometimes they just want somebody to just be there with them. Like Dr. Juliet said, when you say nothing at all, sometimes it's just to know that this person is not judging me, this person is standing by me, this person will be there with me, whatever the outcome of it. And I think that's the thing that we need to learn. We need to stop being, I always say this, stop being judgy of one another, what you do, what you can't do, and that puts pressure on people unnecessarily, and that makes them go and look for all these things. That's a consequence. They go from one fertility clinic to another fertility clinic, draining their resources because of this pressure, and because of that pressure, then I also see another outcome is that there's tension between husband and wife. There's a breakdown in relationship between them, and then, the sexual relations becomes very functional just for the sake of wanting to have a child. This must be this right time. It must be this particular hour, this particular day. It becomes that then. So the unitive aspect of marriage now is being threatened.
Right.
So the sexual relations, which is supposed to be an act of love, now becomes functional because you are being pressured to have a child. So the marriage relationship takes a toll on the relationship. So at the end of the day, yes, a child is a gift from God, but don't forget, the unity of marriage itself is sacred. That you need to work towards keeping it together and not be pressured, and not turn your relationship into some functional thing of just a factory producing babies for that sake. I don't know whether you get what I mean, but that relationship becomes fractured at the end,
Yeah.
and
Yeah.
I see so many of them getting angry with one another, and then what's worst thing is they keep blaming each other. It's your fault, it's my fault, it's the man's fault, it's the woman's fault, and then in-laws add more pressure, or they don't want to say that their son is the problem, or they say, oh, daughter-in-law's the problem. Listen. So you see, it's a complex problem that
Yeah.
affects two individuals, and not just the the thing about not having a baby. It becomes a kind of a challenge, a rough road for the marriage in itself. So what I'm saying that if there are people who are not able to conceive, work on your marriage. That's work on your marriage. And if God chooses not to give, it's not because you are cursed. It's not because, you know, that I mean, if you look at even Mary and Elizabeth in her old age, you look at Sarah, in old age, God bless them with, I'm not saying that, in your ripe old age you're going to conceive, but in the sense that it shows that it's the God who is the provider of that, and perhaps He wants to lead us. The question, I think, is not why me. I think the question may need to change now. Where are you leading me, Lord, through all of this?
Absolutely brilliant. Father, I love how you've simplified things, and in a lot of people, I think, and especially among Catholics, we think that when we talk about a Catholic response, it's something that's so distinct and so distant. You have to be so knowledgeable. You have to know the Bible inside out. You have to know understand the teachings and all. But really, it's um, doing the right thing, as you pointed out. For example, respecting another person's privacy. Stop being a busybody, like in simple terms. Being supportive. Stripping ourselves of judgment of others. And vis-a-vis married couples, it is to go back to the heart of marriage, right? And take away the focus so much on a child validating the marriage, right? It doesn't have to be that way. I love how simply you've put it, and yet so profound. And being concerned about time, and worry about time. The final question I have for you, Father, is what would be your closing remarks or your final message to couples who are going through the fertility journey, or those who may encounter those problems in the future?
Yeah, I think, like you said, Charlene, first thing is work on the marriage, work on the marriage. And the child is the fruit of a lovely marriage, you know. And I think that's what you need to focus. Don't put your pressure on the second, third year, you must have a child, because that in itself is detrimental to the marriage. So I think one of the things is work on your marriage, and if God so chooses to grant you that gift, He will give it to you, and that's the promise that God makes. If He'll give it to you, He'll give it to you, and if not, perhaps He's leading you in another path, and to seek what path is He leading to you. Some people say adoption, some people say other things, I mean, I've heard people say, okay, perhaps they want to help in an orphanage as part of their giving back to society. There's so many things. So perhaps God leads us in different ways. And I think that's the question that we need to ask. As I keep saying, don't ask why me, but where are you leading me in all of this? Even to be a parent, to keep asking, even if I mean, it doesn't mean, I mean, some people say, oh, Father, I want a child because in my old age, my child is going to look after me. And I say, you look at today's society, many of the children are abroad. You are left alone. I see a lot of older people who are left alone with no children to look after them. So that's not a valid argument either, because there's someone to look after me when I'm old. You give them the education, you give them, they all leave the country, they go and study abroad and don't come back. And I see so many older parents, two of them at home, and really, see the beauty of the marriage, the strength of their marriage. So question is, it's not children also not functional, for the sake of looking after you when you're old. I mean, really, I mean, but I think the whole idea is, work on that, because at the end of the day, what brought you together? It's the love for each other. You got together not because first thing is you want to have a child. You came together because you loved each other and you wanted to share your life together forever. That's what brought you together, and that's what would keep you at the end also. So work on that, and between that beginning and that end, if God blesses you with a child in whichever way form, I mean, take in the natural way that we talk about, think that's very important. Just last point, Shalin. I think some questions that people are asking about, natural family planning. Of course, something that we will talk about. But today we also remember that, some of the methods that are available open in the church is that it's not just to be, when you don't want a child. It's also it's called natural fertility awareness, to help you have a child. So there are methods in the church, the natural way, that help you plan, how to help child. So if you are having difficulties, get in touch with one of our natural fertility awareness teams in our parishes, in our diocese we have. They can help you also. So the whole idea of we talk about the Billings method and the other natural methods. There's also how you can help yourself, and part of the whole process is also de-stressing yourselves. From the work, to take time off, and to work on that marriage, and sometimes it's just to pull ourselves out of this. I always say this crazy rat race that we're all in, from day to night. Now that we have gone back to working in offices, it's like non-stop, and relationships are affected. And when relationships are affected, then there's something that we should be concerned about. So I'm saying to couples who are trying, get in touch with our natural fertility awareness team members in our archdiocese or in your parishes. You may have some people who may help you. Work on your marriage, and you will see the joy of marriage.
Brilliant. So beautifully said, and such a beautiful way to conclude. And on that note, Father, I'm going to hand over the time back to you. Thank you so much.
Thank you so much, Charlene. Thank you, Dr. Juliet, Christopher, Dr. Alex, for taking time to have this lengthy conversation. I know we are all in different parts of the world, but yet the beauty of this whole technology is that we are able to have these conversations together. I just want to conclude to say these are not easy conversations. There are so many other issues to be talked about. Dr. Alex and Dr. Juliet and everybody else would know that there are no two similar situations. So whatever we are saying here is not something that's applicable to everyone. Sometimes there are different things that we can talk about. In a more different setting, on a one-to-one setting, to find out. And I hope that people who are having difficulty, who are feeling pressured, to get help, whether it's a counselor or a friend. And if you are a friend, be a friend to them, be a Catholic to them, and help them. And if you need to see a doctor, I'm sure you can see a doctor also to find out what other ways that they're able to help you that are acceptable to the church. They're acceptable. It's not the shortest means. Because I always see people saying that, whenever correct me if I'm wrong, whenever you go and see a fertility expert, the first thing that they propose is IVF. Let's do this almost immediately. And I get a lot of questions about can or cannot. So it recognizes people are also struggling spiritually, and to be able to help them. So if you're one of those people out there, get help. Reach out to somebody and speak to someone, and get assistance, and speak. The church is not there to prevent you, to block you, but the church is there to assist you in whatever way possible. So thank you very much, Dr. Juliet. Thank you very much, Christopher. Thank you very much, Dr. Alex, for taking time to be here with us. Thank you, Charlene, for moderating for us this morning.
My pleasure, Father.
And perhaps we conclude with a prayer, just to remember all those people who are struggling out there also. In the name of the Father, Son, and the Holy Spirit. Amen. Dear Lord, we thank you for this time. We thank you for this opportunity to have this conversation. We especially remember couples who are out there who are wanting to have children, who are struggling, who are not understanding what you want of them, Lord. We pray, Lord, that you may truly reveal your will in a way that we understand, in a way that we can accept that you are the giver of life. Lord, we ask you to bless them today in a very special way. We pray that all of us will be a friend to one another. All of us will offer that support structures that society needs much more today than before, to help one another in the difficult issues of life, whether it is at the beginning, whether it's during, or whether it's at the end, to be able to support them with love, with compassion, and most of all, with the mercy that you offer to each one of us. Bless each one of us, bless our work, and keep us all safe. We pray all this in Jesus' name. Amen. Thank you, everyone. and we look forward to seeing all our viewers again next Saturday, 10:30 a.m. On Catholics at Home. Till then, take care, everyone. Stay safe. Bye.